Good evening, viewers. Today we have Dr. Divya Davis, who is going to talk about pulmonary rehabilitation. Shares the most important features of pulmonary rehabilitation with us, and she herself is a cardiopulmonary rehabilitation specialist. And I welcome you, Madam Dr. Divya Davis. You can present your webinar. A warm
Thank you,
welcome
sir.
and thank you for joining us.
Thank you, Puneet, sir. Good evening to all. I'm here to present to you regarding an outline of pulmonary rehabilitation. First and foremost, I'd like to thank Karnataka Pulmonology Association for giving me this opportunity. To begin with, what is pulmonary rehabilitation? Why is it important? Who can benefit from rehabilitation? Where and how it is done? As the definition says, pulmonary rehabilitation has been defined by the European Respiratory Society and ATS as an evidence-based, multidisciplinary and comprehensive intervention for patients with chronic respiratory disease who are symptomatic and often have reduced activities of daily living. Pulmonary rehabilitation is designed to reduce the symptom, optimize the functional status, increase participation, and reduce the health defects, which causes through stabilizing and reversing systemic manifestation of the disease. Why is pulmonary rehabilitation important? Most of the patients come and complain that they have reduced activity, they are not able to perform their daily routines, they feel fatigue easily, they have dyspnea even with little exertion. Even to do daily chores, they find it difficult. So pulmonary rehabilitation aims to increase the activity so that the physical and cognitive status is improved. It improves effort tolerance by decreasing the circulatory systemic pro-inflammatory markers. It also helps to improve oxygenation to respiratory and peripheral muscles. It increases carbon monoxide diffusion capacities. It in turn helps to gain body weight, increase the muscle mass and strength, which are associated with better exercise tolerance and longer survival, which in turn improves peripheral muscle function, which is an appropriate therapeutic target. Who can be referred for pulmonary rehabilitation? As we commonly know that most of COPD patients are being referred. But other than COPD, all the obstructive lung disorder patients, restrictive lung disorders, patients with chest wall diseases like kyphosis, neuromuscular disorder patients, and post-tubercular syndrome patients, other conditions like pre and post thoracic abdominal surgeries, pre and post lung transplant patients, patients who are ventilatory dependent, obesity related respiratory disorder patients can also be referred for pulmonary rehabilitation. When we talk about rehabilitation, it is to bring the patient to their optimum independence to their activities of daily living. So there are few category of patients who cannot undergo pulmonary rehabilitation because it's a exercise schedule. So these are the patients who have arrhythmias, patients with heart failures, and patients who had recent cardiac events within the past 6 weeks cannot be posted for rehab. What basically happens? Pulmonary rehabilitation aims at improving the exercise capacity.